The contents of this program may not necessarily represent the views of Ummah Channel.
Hello and welcome back. My name is Shakil, Salam, and you're watching Ummah Channel, the health show Hamari Sehat. We're talking to Dr. Ishfaq Ahmad today. He is consultant gastroenterologist based in Worcestershire, and he's here to talk to us about abdominal pain, IBS, and we're going to talk to him about bloating and the gas. It's a serious illness, isn't it? What is the cause of it, and why do we get it?
First of all, I can assure the audience that the gas and bloating is not serious.
It's not serious?
It's not serious. It's a nuisance to have these symptoms, but it does not indicate any kind of serious structural problem.
Okay, just to remind you that Dr. Ishfaq Ahmad is here with us, and mashallah, we're talking about abdominal pain. We're going to talk about a fantastic topic, and we're going to talk about, inshallah, totke as well. So what is the home remedies? And I'm sure as a consultant he will have something, but if you would like to give us your opinion, anything you tried for bloating, for gas, or for abdominal pain, please do call us. The number is on the screen, and we will love to hear from you. Mashallah, we're proud to tell you that Dr. Ishfaq Ahmad is award-winning doctor. He, mashallah, traveled to do the show for us, and we're really grateful for his contribution. And inshallah, you'll probably see him more often. So we were talking about gas is not a serious issue.
Gas and bloating is not serious. It's a very
but it's a nuisance, isn't it?
It's a nuisance.
And embarrassing as well sometimes.
It's embarrassing as well. And what I can assure you, it does not relate to any kind of serious illness.
Spicy food is anything to do with that? Or?
No, not spicy food. I'm going to have a spicy food tonight with you.
All right, okay. After you told us it's not very good for our IBS.
No, spicy food doesn't give you the bloating or the gas.
Okay.
I think the bloating and the gas, first of all, if we can start with, it is again associated with anxiety. The people who are very anxious and they've got stress, they do swallow a lot of air. So whatever they swallow, the air has to come out somehow, either from the top end or from the bottom end. So that's the one thing. And secondly, I think that these days it's very common to people chew a lot of chewing gum these days. So when you chew the chewing gum, so you swallow a lot of air as well. So that air is going to cause the bloating, and the gas is going to go somewhere into your stomach and then cause the problem. And thirdly, eating rapidly, that you are quickly eating your lunch while you are on the move. And during that process, you will swallow a lot of air as well. And fourthly, I think we have discussed earlier that going on healthy eating, all the foods which are associated with healthy eating, they have got fibers in them which are not digested properly. Those fibers are fermented in the bowel and they produce a lot of wind. So if you change healthy diet from white bread to brown bread, then most likely you will suffer from bloating and gas.
Okay.
So that's the price you have to pay.
Okay.
And there are certain diets, and particularly for patients or individual, like our Asian community, which is about 15 to 20% are lactose intolerant. And that means whenever they take something containing milk, their body cannot digest that. And that produces a lot of wind and bloating as well. Those individuals usually avoid anything milk-based product. But if for some reason they have eaten the milk-based product, they will know that they have eaten something. And secondly, there are some vegetables, particularly beans, lentils are very very
Chane?
notorious.
Chickpeas?
Chickpeas are very notorious to produce a lot of winds. And some vegetables like cabbage, broccoli, Brussels sprouts. These are the sort of foods which are considered healthy, but they're not digested properly and they produce a lot of wind. And also the last thing I wanted to mention is these days, I mean, we're told that if you're drinking some soft drink, I mean, any carbonated water will contain a gas. So you're drinking a lot of fluid with the gas, so that gas has to go somewhere. And secondly, in these diet drinks, you know, the Diet Coke or Diet 7-Up, there is a artificial sweetener. So the artificial sweetener is not absorbed and digested by the body. It's again fermented, and that produces a lot of wind. So these are the sort of dietary changes that people can make if they are suffering from the gas. They can avoid, first of all, high fiber diet. They can avoid some vegetables, broccoli, cabbage, and Brussels sprouts, and they should avoid beans, lentils, and also artificial sweetener as well.
Okay. Do you remember Shahida Hanif? We did the show about bowel cancer with her.
Yes, I think I had
She's health promotion specialist.
That's correct.
She's watching the show now and she's saying salam to you.
Wa alaikum assalam. Thank you very much. And I was amazed to see her posting today. She just done a poo clinic.
She did, yes.
Well done.
A flu and poo clinic.
Flu and poo clinic, yeah. That's another important message on the bowel cancer screening, particularly in our community. You know, there is a very established and very good bowel cancer screening program for individuals at the age of 55 and 60. They're automatically invited, even if they have got no symptoms. And the issue with our community is that our community does not participate. And Shahida is, mashallah, doing a very fantastic job in this part of the world. And she's doing a lot of reminder clinics, and like poo clinic, I was laughing on my way home. So please do participate in the screening program,
okay,
which saves life and detects the cancer early before it diagnoses the cancer at a curable stage.
And inshallah we'll do a bowel cancer program with her and invite you as well, you know, whenever you got time. That's another assignment for you.
Yes.
So let's move on to a very interesting topic. You know, it's very common in our culture, in our community, to do some home remedy treatment for abdominal pain, bloating, gas. So have you got some wonderful, fantastic sort of home remedies?
Home remedies, yes. I think they're very useful. And I was not a great fan of them, but now I'm convinced, and I sometimes use them for myself as well. So I think they're famously known in our part of the world as Zubeda Apake Totke.
Zubeda Apake Totke.
Yeah, that's correct.
So this is a male version of Zubeda Apake. Our Dr. Ishfaq Ahmad ke Totke.
Yes, I've picked up from the internet, to be honest. Yes, you may call them my totke. In that, first of all, I think the fennel seed or saunf. If you sort of put a teaspoon of fennel seeds in a boiling water, keep it for 10 minutes and then drink it. That is an excellent remedy for bloating, gas, and most of the disorder of digestion. So that is fairly easy and accessible thing you have got in every household, and you can use that one. And secondly, I think these days you can buy ginger tea as well.
Yeah.
That is very healthy, good for the digestion as well.
You didn't mention my ilachi wali chai.
Oh, that was very good. My stomach is at peace after drinking your tea.
Ilachi is all right.
Ilachi is okay, yeah. Ginger tea is quite good. I mean, the simplest way to make it ginger tea is a tiny piece of ginger.
Fresh ginger.
Fresh ginger in a water, boiling water, and let it soak for about 10 minutes. And other thing is, I think haldi, turmeric, That is very important. I think it was a program last week on the BBC channel that if you eat supplement of turmeric, that doesn't do any good. But somehow that turmeric in your cooking actually improves the quality of our genetic material. So it then protects us from the cancer as well. So the turmeric can be used as well. And apple cider vinegar, you may have an access to that. A spoon of that in a boiling water can be useful. Another thing which I found is baking soda. And you put a little bit of lemon juice. So that is quite useful for all the bloating and gas as well. And good old ajwain. I couldn't find the English of
I was
that.
going to say ajwain is something, you know, a lot of people use it quite a lot. So
Yeah, I mean, a lot of people use it. I think these days they buy it, they come already prepared in the bottles. You can use that ajwain in a little bit of black salt. That is quite useful for, you know, for the bloating and the gas as well. And other thing is people who are getting a lot of bloating is that they can split their meals. Instead of having 2 or 3 big meals, they can have 5 or 6 smaller meals so that the stomach is not distended and the bloating is less. So that is another useful.
so you're encouraging people to have 5-6 meals,
Smaller portions.
smaller portions.
So now I'm not
How
saying...
do you define the portion? Yeah, this is really important.
The portion is,
tell
I think
people.
these days you can, from the market, you can get a plate which tells you how many portions are you eating.
Yeah.
And I think if, like if you take a plate as a full, and if you take a quarter of that and use it as a main meal and have the 6 portion instead of eating whole plate. So you can actually, 1 plate is a full portion. How big is your plate? I don't know.
Yes, this is it. I think it's the size of the plate, isn't it, in our
Yeah.
community? So just to remind you that Dr. Ishfaq Ahmad is telling us not just the home remedy, but he's talking about abdominal pain and IBS. If you have any question relating to the topic, please do call us. Thank you very much for all your messages and feedback. Really appreciate. But please, if you want to talk to Dr. Ishfaq Ahmad, he is happy to answer any questions relating to today's topic. Moving on to, is there any specific diet you can recommend? I know you mentioned bits and bats, but is there any dietary advice you would suggest
For
people
irritable
with
bowel.
IBS? Or,
For IBS, yeah. I think the IBS, about 50 to 60% of patients can be managed with the diet alone. So this is a condition which I think we do find that our colleague dietitian provide us a fantastic service. And we usually obtain their services very often. I mean, there are sort of some basic rule or basic principle in patients with the IBS that what kind of diet they can use. And the first diet is obviously trying lactose-free diet. No milk or milk product for 2 weeks. So that if towards the end of the 2 weeks, if majority of their symptoms have settled, so that means those individuals are actually lactose intolerant, not IBS. So they can continue using soya milk and reduced amount of dairy product. I mean, if that doesn't help, then some patient can try a gluten-free diet.
Okay.
Gluten-free diet is specifically for a medical condition called celiac disease, where individuals are born who are allergic to wheat product. So you know the flour and wheat. So the gluten is in every flour, biscuit, chapati, naan, everything. So that gluten-free diet these days is available on the supermarket, and they can try 2 weeks of gluten-free diet to see if that improves their symptoms. And the rice is okay because the rice don't have any gluten into it. And thirdly, there is a new vogue in the treatment in the diet is called FODMAP. Difficult for me to understand as well. So we usually, what we do is we ask the help of our dietitian colleagues. Basically, if I can show you the diagram again, the FODMAP is basically means that the diet which contains a lot of fructose should be avoided. And in that list, I think if you can actually go onto the internet and type in the word FODMAP, FODMAP, and it will give you all the details. And there are a list of fruits which contains mango as well.
Mango as well, is it?
Yes, mango.
And watermelon?
Watermelon. So there's a list of fruit which you should avoid. Banana is okay. And again, in FODMAP diet, you have to reduce the intake of milk and dairy product. And there is a list of vegetables, which includes Brussels sprout, cabbage, lentils. So you should avoid those or reduce the intake. The beans are notorious. They're coming again. and then lastly, there is an artificial sweetener that you shouldn't try to take artificial sweetener, which does causes a lot of bloating and pain.
Right, okay.
So the FODMAP diet is actually a new thing in the treatment of irritable bowel syndrome, which can be tried. But usually, I mean, either you can search on internet that what ingredients of the FODMAP diet would be, or in your GP surgery there will be a dietitian who can advise you about the FODMAP diet.
Here is the question for you. A lot of people who are diabetic, they take sweetener as alternative to sugar. Can they carry on with that, or are you trying to tell them not to have it?
I mean, obviously I wouldn't advise them to take normal sugar. Because that will increase their blood sugar level. For them, there is an option of, there is a vegetable, there is a sweetener, which is not an artificial sweetener. I forgot the name. It's taken out from a tree, bark of a tree. I think it is commonly available in the supermarket. So they can use that instead of artificial sweetener. So that will, again, keep their blood sugar levels, and it will not cause the bloating and gas.
Okay, absolutely fine. That's fantastic information, and I'm learning a lot, and I hope you do, wherever you are. You're watching Ummah channel, Hamari Sehat, the health show, and Dr. Ishfaq Ahmad is with us. He is consultant, specialist talking about abdominal pain, IBS, and a lot of other issues. We're going to talk about treatment in a minute. But if you have any questions you would like to ask, please do call us. The number is on the screen, and you can ask. Tell us your experiences, and also if you got any home remedies you would like to share. Is he Appa Zubaida Appa?
Ketotke.
That was Zubaida Appa.
Yeah.
Is she famous in Pakistan?
Very famous on the social media.
Social media. Yeah. All right. Okay. So we'll learn from thing. So saunf is fantastic.
Yeah.
But some people there's a lot of sugary saunf, that's sugar coated.
Sugar coated, no, that's not good. I mean, you should buy the simple.
It tastes nice though.
Anything which is sugar based is going to be nice anyway, because we've got a sweet tooth anyway. So I think if you're taking this, that fennel seed or saunf, it should be the plain rather than the sugar coated.
So when people need to go and see a GP if they are concerned about their IBS or abdominal pain?
I mean, that is basically if they are losing weight,
all right,
they should not wait and they should contact their general practitioner.
Is losing weight is not good news for people, who
No, unintentionally.
All right, okay.
I'm trying to lose, I can't lose. So if you are if you're intentionally losing weight, that is fine.
That's fine.
But if unintentionally you're losing weight, then you should contact your GP. And secondly, the IBS or irritable bowel syndrome diagnosis is usually before the age of 50. So any of our audience who is over the age of 50 should not presume that they have got irritable bowel syndrome, and they should seek medical advice. So what we're talking here, remedies, treatment, diets, are individual with less than 50 years of age. So anybody over the age of 50 do need investigation to rule out any other causes of their symptoms. And similarly, if there is a blood in the poo, that is not a good sign.
So this flu and poo clinic is something good to go to?
It's very good. I mean, if there is a blood in the stools, that is not due to irritable bowel syndrome at any age, that need to be investigated.
So that could be potentially as bowel cancer?
Potentially, depending on the age of the
But it's worth testing?
It's worth. I mean, even if it is not a bowel cancer, this could be a symptom for a colitis or Crohn's disease, which obviously can be diagnosed if you attend your GP earlier. So if there is a blood in the stool, that should not be taken lightly. And lastly, that if there is a pain during the night, you know, the IBS individual or patients, when they go on holidays, they're fantastic. The symptoms disappear because there's no stress of work, there is no stress of you know, their home, so they're enjoying. So usually their symptoms do not happen during the night. So if their pain is waking them during the night, so they should consider it seriously, that they should contact their GP for further investigations.
Absolutely, and that is very good advice. We need to take it seriously, and as I said, you know, if you got any questions, please do call us. We're getting a lot of messages, and inshallah, jazakallah for liking the show and commenting on the show. And certainly your orange shirt is very popular, by the way.
I thought I would break the tradition today instead of wearing the normal shirt. So I thought I'm going to go slightly bit more.
Yeah, people liking it, you know, so that's keep up with that tradition.
Thank you very much. Next time I'll be in red shirt.
All right. Okay, that's it, you know. This is it. So we talked about various aspects of it, you know, but if you got any questions, any concern, please do call us. We're going to have a break, and inshallah after the break there will be some key messages from our specialist doctor. We're going to talk to him about his winning formula and his award winning or award ceremony, and also a bit about where this idea come to matrimonial issues and where did he get all the time. We will talk about that in a minute, but let's have a break, and inshallah we'll see you after the break. Assalamu alaikum.